ChatGPT is an AI text generation tool released in late 2022 by OpenAI. It uses statistical language models to generate human-like text. It has rapidly gained popularity, but also has limitations and risks. In academic papers and scientific literature, ChatGPT is being used. Although it cannot reliably distinguish fact from fiction, guidance has been issued for responsible use in academic work. In healthcare, it can provide information to patients, but the output may be inaccurate or outdated. It has the potential to assist with clinical decision support, but it still scores lower than humans. There are proposed uses in nursing research, such as text summarization and data analysis. However, there are limitations and risks associated with ChatGPT. It can output incorrect, biased, outdated, or harmful information. It does not cite scientific sources or provide references. The data is only updated until September 2021. Additionally, it guesses answers instead of clarifying ambiguous questions. These implications for nurses are important to consider. Nurses should use ChatGPT to complement but not replace nursing knowledge. Nurses should also be aware that patients may receive inaccurate advice from ChatGPT. It is crucial to verify any information obtained from ChatGPT. It is essential to recognize the limitations and biases of AI systems. In conclusion, the adoption of ChatGPT has skyrocketed, but it does have downsides. AI natural language technology is advancing rapidly. Nurses should trust but verify as they explore the opportunities and challenges presented by ChatGPT.